All right, so I'm going to be talking about the anatomy of a clavicle fracture. So, the clavicle is a solid bone, and when it is broken or fractured, it can slightly crack or break into many pieces. The clavicle is the bone that connects the arm to the body, so it connects the shoulder blade to the breastbone. It lies above several critical nerves and blood vessels. However, these structures are never really affected or injured when a fracture occurs. The clavicle originates at the sternoclavicular joint, which connects the clavicle to the sternum, and it inserts on the acromion. When a clavicle fracture occurs, there usually comes with lots of pain and lots of swelling. So when you go get it looked at, it's usually diagnosed through a physical exam and x-rays. Next, we can look at the three types of clavicle fractures. So we have the first one being the most common, and it's right in the middle of the bone between the sternum and the AC joint. The second one we have is most medial near the sternum, and it's the second most common. And then the least common, which only accounts for about 5% of the injuries, is the most lateral, which is near the AC joint.
In this diagram, I've highlighted the structures that surround the clavicle, including the clavicle itself as well as the first rib. The surrounding musculature is also highlighted, such as the subclavius muscle, the sternocleidomastoid, the trapezius, the anterior and middle deltoids, as well as the pectoralis major, which all attach onto the clavicle. If we reflect the musculature further, we can see nerves that may be impacted in a clavicle fracture, such as the suprascapular nerve, as well as the anterior, posterior, and middle trunks and divisions, and the entire aspect of the brachial plexus as a whole that run deep to the clavicle through to the rest of the upper extremity. Finally, if we look at the vasculature that may be impacted, we see the subclavian artery that is highlighted passes anteriorly to the first rib and then becomes the auxiliary artery as it passes deep to the clavicle into the arm. Any of these structures could be impacted by a grade 1 middle clavicle fracture.
Falling on an outstretched hand causes the humerus to collide with the clavicle at the AC joint and causes a translation or a fracture of the clavicle bone. A sports injury is usually a direct blow to the shoulder and or falling on directly to the shoulder, and this is where the force is applied at the shoulder and travels through the AC joint to cause a fracture or a break in the clavicle bone due to it not being able to withstand the said force. Traumatic accidents are usually traffic accidents, either from driving a car or getting hit by a car, and the mechanism as to why the clavicle is fractured here depends specifically on what the accident is, but most likely it's due to overproduction of the force or pressure applied to the shoulder or AC joint. Our last mechanism are babies traveling through the birth canal. So as the baby descends down the birthing canal, the clavicle gets stuck in the opening and it will break on impact.
During the clinical presentation of someone with a clavicle fracture, the patient may cradle their injured extremity with the uninjured arm, and there might be some sagging of the shoulder downward and forward. There will be an inability to lift the arm without pain, as well as hearing some grinding or crackling while trying to raise the arm. It also might cause difficulty or diminished breath sounds on the affected side, which may be indicative of pulmonary injury or pneumothorax, which can be diagnosed later. There might be some bumping or deformity over the break, as well as bruising, swelling, or tenderness over the collarbone. In addition, there might be distal nerve dysfunction as identified by testing dermatomes and myotomes, as well as decreased pulse, which may indicate a subclavian artery injury. A clavicle fracture can be diagnosed through the physical examination and clinical presentation of the patient. However, some tests may be required in order to confirm the diagnosis as well as rule out any differential diagnoses such as pneumothorax, vein, artery, or nerve impingements. These tests can include X-rays, CT scans, arteriographies, and ultrasounds.
Depending on the fracture severity and the bone's orientation following injury, 2 different strategies are used to recover from a clavicle fracture. The most common strategy is non-invasive and requires the patient to wear a sling on the affected side. This recovery is common for fractures that occur in the proximal and middle thirds of the clavicle. The sling places the bone in the best position to heal and supports the arm, keeping it from moving. A triangular sling or cuff and collar sling are both suitable options in most cases. Like most fractures, recovering from a clavicle fracture takes time. Healing the fracture takes approximately 6 to 8 weeks in adults and 3 to 6 weeks in children, with generally 6 to 8 more weeks required to regain strength and function of the affected side for both adults and children. During this time, patients may struggle to sleep comfortably, and it is suggested that they sleep in a slightly more upright position with pillows stacked to support the affected arm. Depending on their situation, some patients may not be required to wear their sling at night, and in most cases, it is suggested to remove the sling while sleeping later in the recovery process. When a fracture heals, a bony callus forms around the fracture site, creating a bump. The bone eventually remodels during the healing process and the callus dissipates. However, due to the clavicle's proximity to the skin, the bony callus forming over a clavicle fracture may be visible and is commonly able to be seen in babies and young children. It can often be mistaken by the patient for the clavicle shifting out of alignment during healing, though it is nothing to worry about and it is part of the normal healing processes of bone. In severe cases, such as the fractured bone protruding through the skin, bones overlapping, multiple fractures, or the bone not aligning properly, surgery may be required. Surgery may also be required if the previously mentioned sling treatment does not heal the clavicle. However, not all clavicles that do not heal fully will require surgery. As long as the patient has function and no pain is present, the physician may determine that the patient is able to resume regular activities. Surgery is also more common when the fracture is sustained on the distal third of the clavicle due to the proximity to the glenohumeral joint and the possibility of other structures, such as the acromioclavicular ligament, being affected by the injury. Surgery for a clavicle fracture involves repositioning the clavicle and securing a metal plate on the bone to hold it in the correct position. A pin may also be inserted into the clavicle to further stabilize the bone. Recovery following surgery takes approximately 12 to 14 weeks. Due to the clavicle being superficial to other structures and having minimal fat covering it, patients can often feel the plate through the skin when they palpate the area after recovery. Displacement of the clavicle fracture may also impact other structures, such as the brachial plexus, the subclavian artery, or the lungs, and strategies for recovery and recovery time may have to adapt to these potentially more severe complications.